Hello students, welcome to the physical education class. Today we are going to start with our topic, concept of medicine, sports medicine. Sports medicine is also known as an exercise medicine. It is a branch of medicine that deals with diagnosis, treatment, and prevention of injuries related to the sports. It includes the assessment and the management of the patient with musculoskeletal injuries, medical problems arising from the sporting activities. Sports physician possesses the expertise in general medicine and rehabilitation along with the nutrition, biomechanics, exercise physiology, and psychology. The Sports International Federation of the Sports Medicine, the International Federation of Sports Medicine, that is FISM, where the F is Federation, that is the International Sports Medicine, is the body to provide guidelines for the sports injuries. Its function means what are the aim and objective of the FISM, that is a Federation of the Sports. The objectives are its function is not only curative, that is cure and prevention, but also the rehabilitative so that they can be re-established. The primary focus of the sports medicine is rapid and full recovery of the patient from the injury. So it is a branch of medicine concerned with the treatment of the injuries or the illness resulting from the athletic activities. So, according to the Webster College Dictionary, it is the branch of medicine concerned with athletic conditioning and nutrition, the treatment and the prevention of athletic injuries, and improvement of athletic performance. So, first aid and its objective. So, what is first aid? Is the immediate and temporary care given to the victim. The first objective of the first aid is to save the life. This guides us what to do, what not to do, which can further help us to avoid injury or the damage. And the first aid was used by the St. John Ambulance Association in 1879. Objective of first aid, there are some general principles of the first aid. If these are followed properly, the worst situation of the victims can be avoided by some extent, and these are: number one is immediate aid. If possible, the first aid should be provided immediately. At this time, we should not think about useless things. Time is very precious at that moment, so without wasting any time, the decision should be taken so that immediate aid may be given to the victim. Second is think about ABC. What is ABC? A is airway, breathing and circulation. So first of all, we should check the throat of the victim. He should have unbuttoned the shirt of the victim and he should check up with his respiration. If the victim's respiration is not running well, he should given the artificial breathing, and after that the person giving the first aid should check up his blood circulation. For this purpose, he should check his pulse rate. If his pulse is not felt very by the first aider, he should use the cardiopulmonary resuscitation, that is CPR technique immediately. In this process, artificial respiration is given and after the chest is pressed for the artificial blood circulation, and this process must be repeated at least 15 times. The third objective is a stop bleeding. If there is a bleeding from any organ of the wounded person, it should be stopped at once. The wounded person's life may be in the danger in case of excessive blood loss. If his hand or the leg is bleeding, it should be raised up the heart level. In case of cut or any main artery, it should be kept pressed with thumb or damage till the arrival of the doctor. The fourth is crowd kept away. if it is usually seen that the people gathered immediately when there is any accident, they gather in the form of a crowd. Every individual want to see the injured patient. In such condition, the injured does not get fresh air, and therefore the person giving first aid should also try to keep the crowd away from the injured person. Wrap the injured in the cloth or a blanket. At such time, victim should be kept warm, so he should be wrapped in cloth or blanket. Next is your sympathetic attitude. The person giving first aid should have a sympathetic attitude. When the accident happens, the wounded or the injured person feel fear and terror. He should be treated politely, sympathetically, so that he may come out of the fearful situation. He should also be assured and reassured that nothing serious has happened. He should be assured that he should be all right, and the first aider should not be rash. He should be polite. He should perform his duty with the calm and the patience. Fluid should not be given to the unconscious person. If the person becomes unconscious due to the accident, he should not given any liquid, because liquid substance may enter into the windpipe and that may create the further problem. And the medical aid. The first aider should call the doctor or the expert immediately. Now, the causes of the sports injuries. So, every sport person is prone to accident or the injuries irrespective of the preventive steps or the physical fitness level. The main causes of accident or the injuries in sports are lack of fitness. Lack or less physical fitness may cause injury or accident. Next is poor concentration, that is, the readiness leads to the injuries. Then overstress or tension or unbalanced psychological behavior is one of the cause of accident. Not performing warming up. So not performing proper warming up before the activity is the main cause of the injuries during the sports. Then equipment failure, that is a fault or the failure of equipment can cause the accidents in the sports. Faulty skill actions, player performing faulty skill actions or unbalanced movements while playing or uncoordinated movement may cause injury. Not following rules. The player not following the rules and the regulation of activity can cause the injury. Aggression or violence during the game is also the cause of accidents. Poor play field is not as per rules of the game can cause the injury. Not considering the safety means. So during the game, if we do not consider the safety means, we may get injured. Not wearing the protective guards. Player not wearing the protective guards or not considering the safety equipment is one of the cause of the injury. Wrong training methods. Poor or the wrong training methods, overtraining or overexertion of the muscle that may cause the injury. Wrong treatment. So the wrong treatment of the injury, player not fully recovered from the injury, or the incomplete treatment of the injury, or ignoring the previous injury may cause the further injuries. So these are the causes of the sports injuries. Next is the prevention from the sports injuries. In game and sports, the 100% prevention is never possible, but it can be prevented or minimized by the following steps. Number one is proper warming up. That is must for the player before participating in any physical activity. Why? Because it tones up the body muscle, prepares the player psychologically for coming activity, so it prevents from accident or the injuries. Next is the medical checkup before the activity. Player should be properly medically checked up before physical activity related to the previous injury disease, physical fitness level. They must be fit to participate in the activity. Next is the proper concentration. The player should play with the full alertness and the proper concentration over the activity. Players should not have any stress or tension, moreover, must be mentally ready for the activity. Next is safety guards or the check equipments. Player should check his equipments and their conditions. The player should use good quality of equipments along with the safety guards. Players should wear the proper dress or the kit along with the proper shoes according to the surface as per activity needs. Next is regular conditioning and the proper skill. Regular conditioning improves various abilities of the player like the proper skill actions, develop specific physical components, strengthen weak muscles and the joint. Next is your sufficient physical fitness. For the activities of the physical education, players should have sufficient level of the physical fitness and the players should develop them through the regular conditioning. Consider safety means. Players should consider safety means proper training equipments and sufficient free space around the play field while performing the sports activities. Proper and the safe environment. Safe environment prevent the accident, whereas unsafe may cause the accident or the injuries. Activity under the expert's observation. Players should participate in physical activity under the expert's observation like coach, teacher, trainer or instructor. Good coaching skill. Good coaching skill help to improve the sports in performance. It prevents the player from the accident or the injuries. Follow the rules and the regulations. Players should follow the rules and regulation of activity with true spirit as a sportsman spirit. Consider sports ethics and the sportsmanship. Players should develop and consider sports ethics and sportsmanship. It improves the social quality of the players and thus friendly attitude of the players. Controlling the aggression and the violence. The players should control their aggression. Moreover, violence during the games, it should be prevented or checked. Proper training method. Players should follow the proper training method during the practice, whereas overtraining, overexertion of muscles should be avoided during the training. Follow training principles. Players should follow the training principle in the progressive manner, and these principles help in preventing the accident and injuries. Balanced diet and the good posture. Players should be take balanced diet according to the activity and they should maintain the good posture. Knowledge of health education and the first aid. Players should have a sufficient knowledge about the health education and healthy habits. Moreover, they should be practically trained to give first aid to the injured player. Training regarding the safe escape. The player should be well trained and guide properly regarding the safe escape from the disaster or the accident, like the line movement, knowledge about using the fire extinguishers and disaster management and helping the drowning person. So these are the various preventions which can be taken. So with this we finish this topic, that is a concept of the sports injuries, in which we have discussed the prevention from the sports injuries, as well as we have discussed the causes of the sports injuries, and if we overcome the causes we can prevent the sports injuries. And we have also discussed about the first aid and its objective and the definition of the sports medicine. So with this we finish the concept of medicine. In our next session we will discuss the classification of sports injuries. Till then, thank you and have a nice day.